Hello. Last month we spoke about healthy self, and what better way to follow up on healthy lifestyles than remembering February is Heart Month. While a lot of us think that February is all about Valentine's Day, we need to remember that heart disease is a major problem in our country. Every year, about 800,000 Americans have a heart attack, and about 600,000 people die from heart disease in the United States each year. That's 1 out of every 4 deaths. Heart disease is the leading cause of death for both men and women, and in the United States it costs over $440 billion each year to treat. This month I would like to highlight the Million Hearts campaign. This initiative is dedicated to preventing heart disease and empowering everyone to make heart-healthy choices. Launched in September 2011 by the Department of Health and Human Services, Million Hearts is a national initiative that aims to prevent 1 million heart attacks and strokes in the United States by the year 2017. In its first year, the Million Hearts Initiative has made tremendous progress in raising awareness among healthcare professionals, patients, and communities about how they can help reach the goal of preventing heart attacks and strokes. The initiative focuses on 2 areas. 1, reducing the number of Americans who need blood pressure or cholesterol treatment by empowering them to make healthy choices, including not to start smoking, being more physically active, and reducing intake of sodium and trans fats. Secondly, improving care for people who need treatment by focusing on the ABCs of heart and stroke prevention. A, aspirin therapy if appropriate. B, blood pressure control. C, cholesterol management. And S, smoking cessation. An important part of the initiative is blood pressure control. Million Hearts is promoting new recommendations that team-based care improves blood pressure control. Studies show that patients' control of blood pressure is improved when their care is provided by a team of healthcare professionals, including nurses and pharmacists, rather than by a single physician. We are aware that cardiovascular disease accounts for more than 50% of deaths for our patients with end-stage renal disease. The reported cardiovascular death rates in patients receiving dialysis are substantially higher than in the general population. One of the major reasons for such cardiovascular mortality in ESRD is that cardiovascular disease is present in our patients with chronic artery disease before they even begin renal replacement therapy. We need to work in partnership with our physician colleagues, not only on the diagnosis and treatment of cardiovascular disease in patients with ESRD, but also being active in the screening, diagnosis, and treatment in those with chronic kidney disease before renal replacement therapy is initiated. ANA is a partner in this initiative, and we applaud the efforts by the Million Hearts campaign in its efforts to diagnose and treat cardiovascular disease. I urge you to become involved. Take time to volunteer at community health fairs and screenings to help educate people on the impact of both cardiac and chronic kidney disease. Together, we can all be 1 in a million this Heart Month and every month of the year. To learn more, visit the Million Hearts website. Thank you.